Thank you very much. And I will not take much of your time because the goal here is to actually hear from the discussants and the panelists. But just to give a little bit of an historical and what this note is about. We started in the World Bank in the Eastern Europe and Central Asia region some work on digitalizing delivery of human development services, education, health, social protection. And the big question that emerged is like what it means to do digital. Everybody is doing digital, but we couldn't find 30-page concise notes that actually explain what's the objective to the digitalization, what's the pros, what's the cons, and especially how are pathways towards digitalization, what are preconditions, what should countries expect, and what should countries do at different stages of development. Now we, just to give an example, even in the World Bank, we are doing social registry everywhere, but clearly social registry like the Registro Social de Hogares in Chile, it's different than a social registry and what we should expect from a social registry in a low income setting. So we kind of need to put order in our thoughts. And just to give another example, doing text messaging for encouraging people to apply to social benefits is different than really digitalizing all the core architecture of a social registry and payment systems. But sometimes all that is a little bit put together in a big digital soup. So what we try to do here is not a 500-page report, but is really something for policymakers, for us to discuss, to have in hand, to give a little bit order in our thoughts and to kind of discuss a little bit what we should expect at different stages of both economic development, but also digital development. So that's the flavor of the note. And with that flavor, we would really welcome the discussion and the participants' views on feedback and also on whether what we propose to do is relevant. I stop here. Chris sorry, now I'm the one who doesn't know how to pronounce your last name. Löwe in German. But Chris Löwe is the one who really did all the hard work. So she is presenting and I give the floor to her. Thank you very much.
Great, thank you. And yeah, thanks for those who joined in the room and online. It's a small group, but it will be great, as Jamila said, to kind of actually test this thinking, because this is not yet finalized, and we're hoping to publish, in a couple of months, but there's still some opportunity to shape the thinking. So looking forward to hearing some of your thoughts. I'll dive right into the findings then. So the first part of the research basically looks at how technology has actually been used in the delivery of social protection and labour services or public employment services. And we did that using a framework from the World Bank that's basically the key kind of operational phases of service delivery in social protection. And what we found is that there's examples across this entire delivery chain of how technology is being used with the aim of enhancing the delivery of social protection. I don't have time to go into all the examples, but at each stage, so in outreach, we see digital awareness campaigns, virtual information resources, the use of AI, in the registration and kind of intake registration assessment process, we see how digital platforms are being used for people to be able to apply for schemes, but also to proactively identify potential recipients, and then their information being stored in digital registries, linked with other sector databases at times, and also using new forms of data and statistical analysis or AI techniques as well in the assessment process to determine what needs a person has. And then in the enrolment stage as well, there's some use of automated decision making there, which has also been quite controversial in cases, or automatic triggers to kind of, in the case of a natural hazard, for example, to expand a program to many more people. In the service provision or benefit provision stage, we have the use of both on the back end of payments administration, for example, but also on the user-facing side of receiving payments or services through digital or virtual channels. And then in the final stage of kind of the ongoing management of social protection programs, we see digital platforms again being used to communicate with service users, also to monitor their outcomes, and also at the kind of system level, having the use of digital tools and platforms for monitoring there. So then the next part of the paper basically tries to look at what are the outcomes of this. You know, what do we actually know from the studies that have been conducted about the impacts of digitalization initiatives in this sector? And we find very mixed impacts. So on the positive side, we do have evidence from various studies of improved access for service users. In some cases, also improving their outcomes, you know, beyond just getting a service, actually the impacts that they achieve through that service. Greater accuracy and transparency of services for the service provider, lower costs, increased efficiency, and better data for service improvement. Those are kind of all the potential benefits that were found in some cases in some studies. Then on the other hand, we also do find evidence of quite substantial risks and challenges occurring in some contexts. So those mainly relate to data violations, putting vulnerable service users at risk, heightened exclusion and kind of restrictions on access as a result of not being able to reach the service through digital channels, which results, of course, then in less effective provision overall. And then the last point is to do with also sustainability challenges, and I think this has been discussed in various digital themes, the problem of kind of even where systems actually are working well, the ability to scale those or sustain them, recruitment challenges, inadequate buy-in from different stakeholders, or kind of lack of a long-term strategy can be kind of some of the risks and challenges that were identified. And when we think about what determines which of those impacts occur, we see, well, of course, it's going to depend. I mean, it depends on the context, it depends on the specific design and implementation of that initiative. But beyond that, it also depends on what conditions are in place where the initiative is being implemented. So especially these are the categories that we kind of identified as the key conditions, legal and institutional frameworks, the infrastructure, both the digital and financial services infrastructure that's in place, the digital government capacity, digital access and literacy among the user population, and finally, most importantly, really political will and stakeholder buy-in to make the initiative work well. And then beyond that, we also identify and discuss in the paper how certain digital innovations will have different impacts depending on kind of what process they're part of, what pathway the government is kind of undertaking in the digitalization of their social protection system as a whole, and where it fits in that pathway. Nick, feel free to me if it's too much.
No,
yeah, feel free to move on. So what do we mean by that? That's what we kind of look at in this paper is what pathways have different governments followed to digitalize sector delivery. And what you can see on the screen here is, I guess, the traditional pathway that many governments are following, and this is based on the GovTech framework from the World Bank that many of you may be familiar with, but we kind of looked at how it was working in the social protection sector and saw that in quite a few cases, you have governments that started off with analog systems, kind of their paper-based and manual approaches, and they've been gradually digitalizing those approaches and those systems to have kind of within individual programs, parts of that program becoming electronic, basically. And that's the sort of first phase. But then I guess the next phase, which is maybe the more transformational one, the one that relates more, I think, to kind of rethinking the service around the service user and also around the provider's needs, actually, how can you have that system redesigned in a way that really maximizes the benefits of digitalization? That's this third phase called digital government, and that's where programs are, there's kind of an integrated sector-wide approach to digitalization, and in some cases also interoperable with other sectors too, and having shared digital architecture as well, often relying on a foundational ID system to link those different mechanisms and services. So that was kind of the pathway that we looked at in a number of cases. Of course, this digitalization of kind of the core architecture requires quite a few things to be in place for it to work well. You can do it, but you'll encounter a lot of the risks and challenges that we discussed if you haven't got these conditions in place, which we obviously discussed earlier. But we did note that, you know, in all these areas, it's going to be also progressive development. Like as you work more in it, there's also the opportunity to strengthen a lot of these conditions. But the point is, with core architecture, you can't even get off the ground if you don't have some level of development in place of these areas. But then we ask ourselves, well, what happens in countries where they don't really have a social protection system, like a robust social protection system in place, even in analog or manual form? Like it's a much more nascent sector that they're working in, and that's the case in a fair number of countries, that they haven't actually got around to developing at a system level those approaches. What's happening in those cases? And what we were interested in is cases like Togo, also Democratic Republic of Congo, where actually they've started by going digital from the outset, at least for some proportion of their population. And for want of a better word, I know it's a controversial term, or has kind of come in and out of favor, but we use the term leapfrogging innovations here to basically say that there is the opportunity to kind of move straight into that second or even third phase with certain innovations that are quite novel, even for more advanced social protection systems. You know, the use of big data driven identification, mobile money as the dominant payment mechanism, for example. These approaches can be leapfrogging innovations that may or may not actually become part of a system. So that's another question that we were interested in, is actually, are these just happening as ad hoc digital initiatives, or is there a strategy in place to actually get to parts 2 or 3 straight away? So and in Togo, for example, that definitely is the case. They have that strategy in place. So they can partly substitute for the lack of traditional architecture and can eventually become part of the core architecture, but only with a good strategy for embedding them. And we noted that means that actually the cores, under the second and third column, the core architecture is going to look different from one country to the next. And that's good. I mean, that there is room for the flexibility there, as long as it packages together eventually to become part of the system. We also have a bit of a discussion of the fact that I think leapfrogging is often associated with kind of going rogue, like you don't need to think through, you don't need the same level of infrastructure in place, and you can kind of move much more quickly in that sense. But we caution on that. I mean, even when you look at the cases of these leapfrogging innovations, yes, they may not have the traditional arrangements in place, but they do have kind of alternative arrangements present that allow those innovations to succeed. So, for example, on the payments related leapfrogging innovations, they rely on advanced mobile money infrastructure, access regulations, instead of the traditional financial services. And we also noted that where traditional infrastructure capacity and institutions are maybe underdeveloped, that makes political will and pockets of digital government expertise all the more important. Then finally, this isn't really a pathway, but we noted when we were kind of mapping out the different types of digital innovations, we noted that there was a whole host of initiatives that we called supporting technologies, or digital frills, playing around a little bit with the term, but the ones in yellow here, which basically don't require the core social protection architecture to have been digitalized for you still to be implementing some of them. And not necessarily that that's recommended, but that we noted there is this distinction, and so when governments are thinking about kind of the different investments in digital innovations, it's worth making the distinction between innovations that are going to help you to build your core system versus ones that maybe might have useful benefits, they might be worth doing, but they won't necessarily be contributing to that core architecture development. So they may require some fewer preconditions in some cases. They might focus on just a subset of the population, like the one that's easy to reach through digital means. But even then, you need to be thinking about still having the non-digital alternatives in place, and having the, even if the technical capacity might be being outsourced in some cases, you still need the expertise for kind of leading and managing and monitoring those initiatives. yeah, the last point there, just noting that these are kind of add-ons and not to be confused with kind of the comprehensive digitalization pathway, I guess. That was a bit of a whistle-stop tour of what's quite a long paper, quite dense, but hopefully gave you a flavour. I'll leave it there so that we have time then to move on to the panel discussion. I think the actual questions and discussion of this we're hoping to hear in the last part of the session, but I'll hand back to Emily for the panel.
Thanks so much, Christy. Really fascinating research. I know I've got lots of questions. I'm sure you all do too. But we've been told we'll hold off on those, so keep them ready. We'll come back to it in Q&A. But for now, we're really keen to hear some of our expert panelists' reflections about your experience of digitalizing in practice. So I'd like to first turn to Costa, and it would be great if you could start off by just telling us briefly about your pathway to digitalizing the social protection system in Ukraine, and what have been some of the key developments for you in that digitalization process. I'm just going to show that. Fantastic. Brilliant. We're just getting up. Oh yeah, fantastic. We've got the slide up as well, but Costa, over to you.
Hello, colleagues. Greetings from Kyiv. And if you see this presentation, you see a small illustration of our process of digital transformation. Because on the left side, we talk about our old system, not centralized, without connection with all state register, with papers in process, with without any verification, any automatic verification, without online access to this service. And when we talk about our new system, we talk about right side of this presentation. We talk about extraterritorial principle of using of state services, state social services and social benefits. We talk about DIA, it's our one-stop shop application and state portal with all government services and the social ones in the application. It's our result of our joint work with Ministry of Digital Transformation and Vice Premier Minister Fedorov. And when we talk about inside of this system, I need to say that for 20 years, unsystematic attempts to digitalize social services and the social sphere in general have been made in Ukraine. And they have been made unsuccessful attempts to unify all registers and database, but only with the beginning of the way of digitalization within the country and the adoption in 2021 of a specific action plan, the strategy of digitalization of social sphere, strategy of digital transformation of social sphere. It's about citizen-oriented systematic digitalization of social service, and payments was started. My team has been taking care of this project since January 2022, months before the war. And during this year, we make some changes in our plan because, you know, context, you know, full-scale aggression, and we make a reaction to this situation. And when we talk about development of a unified informational system of the social sphere, we talk about first of all, make a system of interaction, system of connection with all state register with unified social register. And it's about social services and about social benefits too. But due to the full-scale invasion of the Russian Federation in Ukraine, the focus of digitalization had been changed. Due to the large number of internally displaced persons, we need to provide displaced person with the necessary services, such as obtaining an IDP certificate and financial assistance for living from the state for these people. It's about 5 million Ukrainians who change their place of living in the territory of Ukraine, only inside of Ukraine. And we also implement the possibility of submitting application for a number of adoption services on the unified portal of public services DIA. After all, many children were left without parental care. And it was important to us to make the service convenient and available online, without any middleman, without any papers. And we create we create this service from consultation, online consultation, to registration, to adoption candidate. And third, I think that I need to say that we created the iDopomoga humanitarian platform, iDopomoga.gov.ua. This platform, it's our reaction, our answer to the humanitarian challenge. And the platform has 3 directions. iDopomoga state. It's something like landing page with information about assistance from the state for our people during the war, especially for INDPs. Second section, it's iDopomoga volunteer. It's a P2P assistance from volunteers from different countries to Ukrainians. It's about direct support without any middlemen. And iDopomoga International, it's a section of our platform. It's about monetary, it's about cash assistance from international organization. When I have a first meeting with international organization in Kyiv in April 1 year ago, our partners say that in Ukraine it's the first experience for humanitarian organization to use state platform to realization project of cash support for our people, because during the war our banking system is working. Our register is working. We have possibility to verify all data about social status. And when our partners, United Nations agencies, Red Cross, etc., ask about roadmap, we talk about fast memorandum of understanding with ministry. Second step, it's about choosing the category. For example, when our partners ask about pensioners in Kherson region, we send data of our citizen, data with the payment requirements of our citizen directly to our partners, for example. And our partners use different payment methods to support our people. Some of them use Western Union from Italy. Some of them use Ukrainian state banks. We don't it's opinion of our. It's only about opinion of our partners, and I think that our strategy of digital transformation is more globally than I talk. But you need to understand that humanitarian reaction and our task during the war is very specific task. But when we talk about digital transformation in Ukraine globally, I totally agree with your slides about e-government. When we about digital government, when we talk about services for our citizens, we don't talk about different services, different sites. We talk about DIA application or DIA portal. It's one-stop shop for different services from different ministries. And my digital team make something like back offices for these services in our infrastructure, and one of our main tasks It's making of simple and convenient services for our people. It's about multi-channel experience, because part of people use a mobile application. Some of people use desktop portal. Some of people need to go into social center, social office in their region, and we give this possibility too. And I need to say that when we talk about digitalization and digital transformation of social sphere before the war, we talk about transparency, we talk about efficiency, we talk about simple services for our citizens. But when we talk about digital services during the war, it's about safety too. Because when you hear air alarm, you don't need to go to social offices and stay in queues and moving through the city. What you need, it's your mobile phone, smartphone, or laptop to use these government services. And it's about safety, and it's about access, and it's about fast reaction, because 5 million internally displaced people, it's a huge quantity of our citizens, and I think that it's our biggest service of registration for the last years. Thank you.
Thank you so much, Costa. I mean, incredible what you've achieved in such a short space of time, and that point on safety, I think, a really important one. But also, as you were talking about the sort of the role of digitalizing social protection within the broader digitalization of government, and understanding that broader pathway and opportunity. And I think that's something that would be great to come back to in discussion. But first, Veronica, I'd like to come to you, and it would be great if you could please give us a sense of the pathway to digitalize Chile's social protection system, and especially the social information system that you're in charge of. So Veronica, over to you.
Thank you very much. I'm very pleased to be here today with you. Well, to start, I would say that the Chilean pathway to digitalizing the social protection system can be summarized into 3 moments or stages. The first one was very early at the end of the 70s with Pitacas. This instrument evaluated the socioeconomic condition of the households through a score, which also determined the priority to access social benefits. This score was based heavily on the possession of material goods, but that was left behind a long time ago. On that time, the municipalities collected the data of the families at the local level, and then integrated them into a central system provided by our ministry. They sent Excel files, and we integrated them. In technological terms, the lack of early cross-validations allowed the same person, for example, the same person to declare different households in different cities, causing integrity failures. This resulted in inclusion or exclusion errors when delivering benefits. Even though it was useful at the time, it was necessary to move towards a better system appropriate to the new conditions of the country, which bring us to the next stage. The 2004 law created the Chile Solidario initiative, which linked extreme poor families to numerous benefits and services with active social worker intermediation and outreach. The design of the national system for social protection addressed the lack of communication among information systems managed by different agencies for numerous programs serving the Chile Solidario initiative. The Chile Solidario system also mandated the creation of a social information registry, combining both the household registry named Ficha de Protección Social with an integrated beneficiary registry that links numerous programs provided by different entities. Ficha de Protección Social was the new instrument that characterized the families and transited from a perspective of deficiencies associated with poverty to one of socioeconomic vulnerability. In technological terms, this Ficha de Protección Social used a Proximum's testing system built on self-reported information from citizens, added to the first integration with the Chilean Civil Registry to avoid previous problems. This early interoperability was facilitated by the unique national ID that we have in Chile from a long time ago. To formalize the operation of this race, and in consonance with the 1999 law on data privacy, its functioning and limitations were also regulated in 2007. Since 2008, we have signed several collaboration and connectivity agreements, which provide a formal framework for the exchange of data between the different public entities. As of today, we have 56 agreements with institutions of the central level, central government, and with 345 municipalities along the country. Most recently, progress was made thanks to the advance in technology and connectivity, such as the increase in interoperability between institutions and access to higher quality administrative records, which bring us to the first stage, which is the current one. In 2016, the Social Registry of Households came into operation. This is the Registro Social de Hogares. RSH was designed as a highly interoperable system that combines citizens' self-reported information with batch and real-time data exchange with many other administrative systems. This registry now covers 86% of the Chilean population, let's say 17 million people, and serves over 120 programs, running from scholarships, education, labor aid, entrepreneurship, and many others. This RSH also provides a citizen interface, which is permanent, integrated, and dynamic. Citizens can update their information and access their information online or through local offices. Self-reported information includes family composition, housing conditions, education, health, occupation, and income. And data provided from different other organizations include taxes, social security contributions, unemployment insurance, pensions, health insurance, health conditions, education, and property and vehicle ownership. In summary, I would say that the key developments in this digitalization process were of course, the existence of a unique national ID, which makes everything easier to connect the data. Also, a centralized platform capable of exchanging data with relevant organizations such as the Civil Registry and other managers. Also, the use of the combination records with administrative records with self-reported information, but we can't let one part of the data behind. I also must point out that all what I said is behind the protection and respect for the privacy of the people's data and the legitimate use of this data by the government. And this is very important, especially since 2018, when the protection of personal data became part of our constitution. That's what I wanted to say about this. Thank you.
Fantastic. Thanks so much, Veronica, and a lot to dig into there as well. You've already touched on this a little bit, but would like to turn now to talking about the results in practice and really starting with the positive. So could you begin by just talking briefly about the biggest benefits you've seen from your digitalization efforts? And I would ask you respectfully to keep this fairly brief because I'm keen to move on to discussion shortly. So Veronica, over to you first and then to Costa.
Thank you for the question. Thank you for question.
Sorry, Costa. That was my mistake confusing. We're going to go to Veronica first to talk about benefits, and then to you. Thanks so much, Veronica. Over to you.
Of course, no problem. Well, I would say that the main benefit of having higher quality data at the right moment allows for more justice, determining the eligibility for social benefits and cash transfers. Secondly, the higher access to computers and internet allow the creation of this citizen portal available also through cell phones. Where people can see their own information and they can update, correct, or complement it following a protocol that we give to them in order to have reliable information about their socioeconomic vulnerability. Also, this makes it necessary to visit the municipality, saving time and money, which was a big change between the Registro Social de Hogares compared to the Ficha de Protección Social. By being part of a social protection ecosystem, many public agencies at the central and municipal levels can use this information to improve their own social protection processes. For example, institutions can find out what benefits families have already received to enhance the effect with complementary aid or to avoid duplication. This is also useful in earlier stages when designing new social programs.
Fantastic. Thank you so much. Costa, same question to you. What have been the greatest benefits?
Thank you. And in order to release the results, it is important to first understand our context in which we are currently working. This is a full-scale aggression of Russia, as I say. And my opinion is our biggest achievements, and it's about services for internal displaced people. It's about services for adopters and the creation of our iDopomoga platform, about which I have already told a little. And I need to say that now, during the war, we implement in our new system, unified informational system of social sphere, six social benefits. It's much popular social benefits in Ukraine, social benefits for families and kids, and in Zhytomyr and Rivne regions, thanks to support of World Bank and World Food Program of United Nations. World Food Program, it's not a regular donor and regular sponsor of digitalization. They work in another direction. But when we work in colleagues during first months of the war, they say that, Kostya, you not need only food for people. You don't need only payments for people. You need infrastructure, because when we talk about register, when we talk about payments for people, you need to have a good payment infrastructure. And I present for colleagues this big project of our informational social system. We lose a budget in previous year because we focused our budget funds to our army to save our country, and World Food Program support us. And we go ahead with the development of this system and implementation of step-by-step implementation of a subsystem of the system in our region, and make services in our state mobile application and portal. And I need to say that we have a large number of forcibly displaced persons, hundreds of thousands of people per day, and they need support. And they located in different regions, central Ukraine, Western Ukraine, and for quick registration of these people, we make multi-channel, as I say, we make multi-channel possibility to registrate, self-registrate mobile phone, and it's about automatic registration. It's about automatic decision. If it's about social benefit without state state servant. Sorry for my English. And when we talk about adoption service, it's not about simplify of service. We understand that it's not only about bureaucracy. It's about safety of people. It's about good decision of potential parents, and we make a fast and simple service, but all controls, all verification of candidates in working in the system, and now we waiting the first adoption. After long process of we make this service previous summer, and in first stage it's only about consultation. Next stage it's about registration in candidate status, and after that next steps. And now in this spring we waiting for first adoption via our mobile application. It's not only mobile application process, but consultation and initiation of this process starts online. And I need to say more about e-Допомога. As I say, e-Допомога, it's about three sections: state support, P2P volunteering support, and government.
Hang on. Oh, sorry, Costa,
You're on mute.
I'm sorry.
And actually, Costa, while you're just pausing a second, oh, sorry about that. I just also wanted to move on to talking a little bit about challenges. And I think you've already mentioned some already, and obviously given the fact you're in a war, you're facing particularly pressing challenges, but could you just talk about in the context
okay, we don't talk only about results, we talk about problems and challenges too. One of problems is financing. When I lose budget financing, I lose 4 months for finding donors, sponsors of our digitalization. It's the first challenge. Next challenge, it's about e-learning of our people. Our previous system development in 1998, more than 20 years ago. And it's old system without controls, without verification, district oriented, with the possibility of district corruption, without control. But our people in social offices, it's thousands of people know this system very good. And when we implement a new system, we have a lot of job to study, to learn people about the system, to develop help desk to support our it's not about citizen, it's about social workers who work, social state servants who work with this system, because it's not a front system, it's about system for social people who work with social benefits and social services. It's our users of our system, and it's a long process about and third, I think that third challenges, it's a migration of data from old system to new. It's really trash, because in previous system we don't have automatic controls, and any people and any districts have possibility to write not correct information. And when people go into social office, he use only papers, and papers, it's not about control, it's not about connection of registers, and some of decision is wrong, and we find some duplicates of decision, wrong information, etc. And I think that we clean in 3 months our previous data from previous system to migrate to our new system, and this process is going. Thank you.
Thanks very much, Costa. And I think for those of you who were with us this morning, there's some really sort of common themes there that we were discussing earlier as well, around sort of digitalization to public finance processes, you know, particularly sort of uptake and adoption, capacity building, but also real issues with sort of data quality, governance, sharing. And I know Veronica touched on those too, so maybe we can come back to some of those points. But first, Veronica, same question to you. Could you talk us through 1 or 2 particular challenges that you face and some of the lessons learned from them?
Yes, of course. I would say that maybe one of the recent challenges is the increase in migrant people in Chile, which are in a regular situation. They do not have their unique national ID number, and that's essential for maybe all of our systems. So we are trying to find out some strategy to be able to add these people and make them part of the social protection system in the country. Besides that, on a more structural perspective, I would say that the use of administrative records is a permanent and complex challenge. Since this data is collected for different purposes. They are not collected for social protection or for the use by the government, but for business processes. This creates a various complication. For example, during the collection of the data, problems, errors may occur, and if this specific data is not it's not an essential part of the particular organization, they do not have the incentive to introduce some form to correct this data. This data is collected with error, with mistakes, or they do not have the right incentives to keep them up to date. So that's another problem. So in the same vein, administrative records we use come from public institutions. These public institutions collect all the set of data from other companies or other public institutions. So it takes a time, 1 month, 2 months, to integrate all this data and to be able to have this set of data to work with them. That makes very difficult and very hard to use with and interoperate with this data to have information on time and precise to make decisions about people. Another permanent challenge is the need to increase and improve interoperability. With this, I refer to the idea of accessing the data when we require it, not 1 month later, but now. And we have seen that not many organizations are in the capacity to provide that kind of interaction. So we have several problems. I would say that they are technological capability problems of some very important institutions that need to provide data for this purpose. Most of these public organizations do not have sufficient technological capacity to handle significant volumes of simultaneous and concurrent online queries. This limits the potential that interoperability can provide to household socioeconomic characterization processes, such as shortening the time between a change in a household condition and its effective reflection in the socioeconomic characterization. This latter issue proved to be a difficulty in the face of substantive problems suffered by households, such as negative effects on income due to a calamity. For example, here in Chile, we have many earthquakes, which causes a high impact, economic impact in many households. We don't have the information on time to be able to capture that issue regarding the condition of the family. These limitations in interoperability are part of a national diagnosis for which improvements are being made in terms to improve the capacity in people and to make some investment in more appropriate technologies for this challenge. Some concrete examples include the increase in public institutions that are migrating part of all of their operation to cloud solutions in order to have elasticity when receiving increase in data requirements. In the country also, we have the challenge to implement a digital transformation law within a period of 5 years that obliges, among other matters, public services to implement interoperability solutions that prevent people from having to repeatedly provide the same personal information when some other government services already has it, and should make it available to others that require it too.
Brilliant, Veronica, thank you so much for that. Really interesting. We're going to move on to audience discussion soon, and we'll go first to those in the room and then to those online and give you the opportunity to raise your hands and ask questions. But before we do that, I'd like to go to Richard, because Richard, you've worked with quite a range of governments on the digitalization of their social protection systems, some of whom have started from sort of not having much existing system, and others who have had quite advanced sort of paper-based systems that they're now looking to digitalize. You've also been following some of the developments in emerging technologies in the social protection space. So based on what you've seen, how might the digitalization pathway differ for countries that are only now starting to develop a nascent social protection system? And I wonder if you might talk to us about, from your view, what potential there is for governments to be able to leapfrog in their system development, drawing on some of these new technologies. So Richard, over to you.
Yeah, thank you so much. I think my other colleagues have already touched on some of the very interesting examples. I think that the first thing to remember is that if you're looking at a nascent country or a nascent social protection system in a country, there are a few key characteristics. So I think that the best way of looking at this particular issue is to first say, well, how does a nascent social protection system look like? And what does it mean for digitalization? So the first thing is, and I think Veronica's Chile would not be falling in this particular category, because clearly in the 70s, they were already experimenting with some digitalization. But I think the key characteristic is the pilot schemes, sometimes not national in scale. And of course, the bigger advantage that comes with digitalization there is that the processes are not very mature, so they're not necessarily written into law. It's very easy to make the changes and often easy to adapt and to take advantage of the latest technologies in the market. The other, of course, other characteristic is that there are multiple donor partners or development partners, often supporting some of these nascent social protection programs through pilot initiatives or working jointly with governments around the world. What that means also is that there is often the availability of budgets. I think we heard from Ukraine that I think budget is a very critical resource or a critical requirement to be able to finance digitalization initiatives. So budgets is a critical one, which means if there are donors that are willing to support, whether it's World Bank, whether it's the UN organizations and others, it should be practically possible to not only support the social protection program or scheme, but also equally more important, support the digital initiative. But the risk which is there, and I wanted to flag that, is that it could run into, there could be unsustainability if there is no, if these digital projects are not underpinned by a very careful feasibility assessments. And these governments do not budget for maintenance funds that are used to maintain these systems. Or the other factor, of course, is in a nascent social protection system, you often have either absence of or evolution of social protection policies, strategies, program designs, operational processes, and documentation. What that means is that there is often need for agile information systems. So thinking through digitalization means thinking through solutions that can be able to adopt to this evolving social protection system. So unlike, for example, a very mature social protection program, say, for example, in South Africa, which has been running for many years, it's part of the legislation and its functions. In nascent social protection systems, it means the documentation, the processes and all that are not well concretized or mature enough. So it means that the systems also, digitalization initiative need to be able to, or solutions need to be able to respond to that. So what that means, practically means, is it may not be attractive for mature software solutions or providers who already have very well set software platforms or solutions for social security sector. And finally, sometimes there is weak or non-existent data protection laws, and I think it was good to hear the process in Ukraine and also in Chile. Guidelines and protocols. So where there is lack of legislation, it can be a window to move quickly and do rapid integration initiatives. I recall in Uzbekistan, over a period of 3 or 4 years, linkages were done with more than 20 government registries and information systems by this national single registry. However, so sometimes, for example, where there is no law, for example, that says there is need to have data protection impact assessment or other protection requirements, sometimes a lot of innovations can happen. That is an advantage, but there's a downside to that, in the sense that there's a risk of exacerbating individual data privacy issues among especially the vulnerable persons in the process of trying to put in place digital initiatives or schemes to support social protection programs. So that's the first response to the part of the question. Over to you.
Great, thank you, Richard. So final question then for you before we move to Q&A, which is thinking about some of the key takeaways for countries here, for those who might be listening on the call from governments or working closely with governments on digitalizing their social protection systems. Richard, if you had to pick just 1 or 2 lessons that might help other countries think about successful pathways to digitalize their social protection systems, what would those be? What are 1 or 2 of the absolute essentials that you think need to be in place to maximize the benefits of digital while addressing some of the substantial potential challenges and risks?
Yeah, thank you. So I think the framing presentation already mentioned that digitalization, of course, especially for nascent social protection systems, there is opportunity for leapfrogging. I think there was already the framing, so any country can pick whether it's a process or technology and be able to move forward rapidly. I'm going to touch on that before I maybe answer your question. And I think the first part is that is the flexibility to choose and configure multiple information functions along the social protection delivery chain. I think we looked earlier around every function within the delivery chain, whether you're talking about registration, eligibility assessment, payment or benefit delivery, complaints and grievance management and others. Most of those particular functions can be configured and technology deployed to support one social protection scheme or multiple social protection programs. The second part, of course, for nascent systems is ability to leverage new and emerging technologies. And I think we've already touched on that, and I'm not going to go into a lot of details. But we are looking at a plethora of technology choices, which were not there before. I think Veronica mentioned 1970s. I'm sure, for example, that mobile money option was not there. which provides very interesting options for the new programs or schemes or nascent social protection schemes in countries. We talk about QR codes, SMSs, internet, machine learning, and all that. Of course, some of these technologies, of course, also call for data protection impact analysis because of the potential risks that may be associated with the employment of these technologies. The third point also is there is a lot of affordability of hardware devices with integrated and smart technologies. Previously, for example, when countries were doing registrations, there was a lot of investment. You had to invest in a lot of hardware infrastructure. It's quite common nowadays for registration process to happen with the numerators recruited already having, for example, a smart device. Of course, there should be requisite security processes before maybe data can be collected using personal devices. But there are multiple options, and countries are exploring through their digital transformation strategies options of utilizing some of the available solutions. And then, of course, there is the co-creation. So digitalization of social protection systems can also create demand so that other enabling legislative and governance environment elements can be also put in place. So it could create demand for digital transformation strategies to be enacted, policies, laws, data protection laws to be put in place, the need for foundational ID systems, and other broader e-government systems. The second part, quickly going to the second part of the question. So the lessons, two key lessons that I wanted really to emphasize strongly from experience working across multiple projects in many countries. If you are working on digitalization initiative, the first part is the clarity of policy imperative. So there is a saying that the dog or the tail does not wag the dog. It also applies to technology, and it's extremely important that the technology should not drive the social protection scheme design. There should be clear thinking in terms of the objectives, and I think it's good that we are emphasizing the importance from the outset, thinking through the reform, thinking through the design before the technology solution can be configured or put in place to support. So ultimately, digitalization should be able to provide value to stakeholders, the beneficiaries of social protection schemes, the general public who are struggling with loads of paper. We have to be carried around, who are being moved from one office to another. Digitalization should address that. There should be transparency to the program managers of the programs. There should be also information available good information available for the policymakers. So that's the first thing in terms of clarity of the policy will ensure that there is the technology that will be deployed will now ensure that the process moves even better. Second part is, I think which I thought was very important, is aligned to digital principles. Digital principles have been there for a while now, and they emphasize multiple elements that are so crucial: designing with the user, understanding the ecosystem, thinking about the scale, building for sustainability, thinking very carefully about if you are doing if it's a donor-funded digitalization project, what does it mean when the funding comes to an end? Plan that from the outset. Being data-driven and good quality data, building for sustainability, using open standards. There are quite a lot of global open source tools that are becoming available within the sector, addressing privacy and security and being collaborative. So I think there are quite a lot of initiatives that are currently ongoing within the sector to shed more spotlight on that particular issue. So what are the two absolutely essential things that need to be done? Enabling environment. I think that has already been emphasized by Veronica and Kostina from Ukraine. Legal framework, digital transformation, data protection, political will and leadership, and a strong governance framework to address challenges and risks and champion that. So where you have, for example, a digital transformation strategy, it's much easier. Where you have a data protection law, it means you're beginning from somewhere. Veronica mentioned about already processes that ensure that you do not duplicate data collection. You collect the data once and then share with others. But you can only do that when there is a robust data protection framework to enable that. And then, of course, the second part is transform processes, reform design, and solid and clear business requirements. No technology provider wants to come and work on something that is not very clear at all. I think if it's a social protection program, you're talking about you're designing a social registry, you were very clear about what it is. If it's a program information system, and these are the functions, you need to have very clear operational procedures and processes that document that. That makes it easy. If there is need for reform of the processes fast, then that needs to be done before you even bring on board the digitization initiative. So those are the two essential things that I could quickly think on top of my mind. Back to you.
Thank you, Richard. Some really great messages to end on there. Really support, I think, emphasising the importance of how you go about some of this work and the digital principles for development, particularly designing with the user and sort of building for sustainability. And there's some great resources online there, which I'll put in the chat if folks haven't come across that already. But also, I think that message of really starting with clear outcomes rather than a technology solution. And again, that was something that came up really strongly in this morning's discussion. So I'm really pleased now to turn it over to Q&A. My ask would just be that you keep your kind of comment or question as brief as possible so we can get round lots of people. For those online, please do feel free to raise your hand, or if you feel more comfortable, put a question or a comment in the chat. But I'm going to go to the room, folks in the room first, for any kind of questions and comments. And if not, I'm going to put Anir on the spot, because I know, Anir, you've been doing some fantastic work on digital social protection in Bangladesh. It would be really interesting, I think, to hear sort of what resonates in this sort of discussion so far, and what have we missed?
I think a lot of what, thank you, Emily. So a lot of what...
Sorry, Anir, do you want to just introduce yourself as well?
Oh, sure, of course. My name is Anir Chaudhary, Policy Advisor of the Digital Transformation Program of the Government of Bangladesh, called Aspire to Innovate. Been at it for the last 15 years, the last 6 years on digital protection, social protection. So a lot of what the panelists and speakers have talked about, I think, resonate. Starting with the outcomes, going iterative, no big bang approach. We now cover about 30 million people with various forms of social safety nets, all of which became digital during COVID. And it was only possible because we started the work in 2017 with about 100,000 in the pilot. That was also a big pilot. It's a big country in terms of number of people, 170 million people. And if we hadn't done that, if we hadn't sort of matured the technology by iterating from a small pilot, from a small architecture. And architecture was always, from the very beginning, we said it's a people-oriented architecture. So we wanted to, we called it the choice architecture. How do you want the money to be delivered to your hands? So do you want to go to a bank branch? Do you want to go to one of these thousands of non-bank branches that we created? Do you want to go to a mobile money outlet where you can actually take out the cash? What kind of biometric? We actually linked it with a national ID for students under the age of 18 who did not have national ID. We actually linked it with birth registration, which was then later linked with national ID. So a lot of what was discussed resonate. Two things I wanted to bring up. One is, how do you, I mean, when you're building an architecture, often when you're doing iteration without, so there is the social outcome, but also there is the large, I think, architectural plan that you have to have. Otherwise, what happens is you start building pilot, and there is this concept that came from mobile health piloting in Africa called pilotitis. So essentially, you do a lot of pilots, and then they fizzle out as pilots because you haven't built a large architecture. So I just wanted to know from anybody on screen who presented about how you make that conscious decision about as you're piloting, you also have to keep an architecture, large architecture in mind. So I just wanted to ask that. Another question to Costa in Ukraine about how the P2P really works. It sounds like a very interesting social protection done by people for people. And exactly how that's done, how it's monitored, how quality assurance is done, some light on that would be really helpful. Thank you.
Great, thanks, Anil. Should we go, Costa, should we go to you first and then to Veronica?
Thank you for question, and I start for from second question. It's a very interesting mechanic, but its mechanic is very popular because we use mechanic of online gift certificates. For example, when you donate for Ukrainian from another country, you make it online from credit cards or PayPal, Google Pay, etc. And on the another side, our citizens have gift certificates on the fixed amount for food, medicine, or fuel. And we open to integrate with any Ukrainian worked retailers, retail networks, and these retail networks in cashiers of these retail networks use these gift certificates, and people going from these retail networks with food or with medicine or with fuel when it's about gas station. It's very transparent. We have dashboards and analytics about our process, and when you are a benefactor, you have a simple, and I think it's not about stigmatism, it's very it's online, as an online report you have from our system is fiscal check from the store with official check from the store with list of purchases of people whom you support. We talk about this system. It's not about social benefits. It's not about social services. It's something like additional support of our people during the war. And we make this technology for Ukraine, but we think that after the war, this technology is convenient for any countries with humanitarian disasters to direct support of people. It's better than classic humanitarian, humanitarian aid, because it's not in natural form, because it's about support of final people who need support, and support all supply chain in our cities, support of stores, support of producer and personnel of these stores and local producers too, and it works. It works. I think that it works automatically and not bad, but we need a more information about this platform. People from 50 countries use our platform, from Ireland, Norfolk to Canada, all around the earth. But I think, but it's but from 5,000 of our benefactor, only 700 it's international benefactors from another countries. I think that we need more word of mouth about our platform, but because we don't have marketing budget about this charity humanitarian platform, but our influencers in Ukraine support us, and some international influencers support us too. Thank you. And the first question about pilots and the quick project, as I remember, in a region we use this practice. For example, now we our old system work in all regions of Ukraine, but six popular and much biggest social benefits we implement in Zhytomyr and Rivne region. It's our pilot region, and we work directly with these people who work with our system. And my team and I regularly come to this region to talk with our users and to see, to have a feedback, real feedback from our users. Thank you.
Thanks so much, Costa. Veronica, did you want to say anything on the question of how you overcome pilotitis?
Yes, of course. We have a couple of examples I can share with you. One of them is named Gestión Social Local, something like social local management. This is an experience working with at the municipal level. The idea was to understand how the social workers face everyday relationship with a citizen, and trying to understand what kind of information they needed to perform a better attention to the people and give more appropriate help or aid to these families. This work started with the help of the World Bank, and it started with a handful of municipalities drawing and identifying each of the processes and the people involved in each part of the process, and the need to communicate people from one office of the municipality with another from the same municipality that maybe were not talking. And they were connected and they agreed to work together. And this was not only about the technology behind, and was not only about the data we were providing to them, but also, it was mainly about reaching this agreement inside each municipality to work together, using this platform that we provided to them to improve the experience of the citizen in terms of the social protection. As I said, this pilot started in 2019 with a handful of municipalities. Today, over 200 municipalities are already involved in the project, and the goal is to reach the 345 municipalities. Other example of piloting is with what we call oficinas locales de la niñez, something like children local offices. These are special offices installed to protect the children and protect their rights and avoid vulnerabilities. This is part of a main public policy in order to protect the children and teenagers, to improve their relationship with the state and provide everything that the state can give to them to make easier their life and avoid risks or the problems with their rights. And this started also with a handful of municipalities, and this year we're going to reach over 90 municipalities. So those are two examples.
Thanks so much, Veronica. Really nice, I think, examples of, and go back to Anir's question of sort of thinking big. You've got those big aims in mind, but starting small with a handful just to test out. Before we go to some questions in the chat, any other questions or comments from folks in the room?
It's Yamele.
Oh, Yamele, yeah, please come in.
Thank you. Just on the comment of the pilotitis. I'm familiar with that. I think sometimes what we should pay more attention is really the government capacity to own the agenda in the medium to long term. I mean, I worked in various contexts, And yes, with a project, one can always finance a PIU, that finance expert, that finance the social registry, but then it needs to be transferred to the government, and I think eventually, not to the PIU. The PIU is part of the government; it's parallel to the government. So for it to be sustainable, it really needs to become core of government activity. And I think that's much easier in settings where there is already a government that can hire and pay and keep people doing the IT, maintaining the IT. I mean, we were just doing in Albania a project, and the project financed some development of the social registry, but then it got integrated into the government. It's going to stay and remain there, and that they're going to work with it. In much lower income settings, sometimes the problem is really that integration step. So I actually think we should learn sometimes to better adapt our ambition in a project, in a financing, with actually the long-term sustainability view. And that's something I think we don't always get right. I think we're starting to get it right, but we don't always get right yet.
Thank you. I think really important point there on sustainability. And I'm conscious that we're almost out of time, and I want to be respectful of everyone's time, and we'll try and finish in 3 minutes. So I suggest we pick just one question from chat.
Yeah.
Do you want to choose?
Well, I can take, because the two from Pamela. So on the chat there were some questions about the research and the scope of it, basically which digital innovations we studied. And the response was it wasn't, we looked at high, middle, low income countries or regions, and we were looking for studies where there was kind of rigorous evaluations in place. So we didn't have they didn't have to be innovations of a certain time length or anything, just because there aren't actually that many studies of digital social protection. I mean, there's lots of studies of cash transfers, but isolating the impact of the digital intervention was quite difficult to find studies. So yeah, we didn't have a minimum duration, but we did try and think about how it might be, how the impacts are going to be different if an innovation is in place for longer. And the question on sustainability and looking at systems over time, that's quite a limited area. A lot of it isn't documented, I think, when it doesn't go well, but where there was evidence on that, we've included it. So those are the first two. The last question might still, that's not for me, that's for the government partners. But I'll just relay it if that's okay. And for Veronica and Costa, what was the initial trigger for the move towards digitalization, and where did you find support and face opposition?
And can I challenge you both to try and answer that in one sentence? Veronica, should we go to you first?
I would say it was the need. We had to take care of many people, and we need to use the resources as the best way where it was possible. And the technology is an important tool to do that.
Fantastic. The need. And Costa, same question to you. I mean, you talked a bit about it already, but if you had to sum it up.
I need to say that we have a good support inside our government, because we have not only one vice prime minister for digitalization and the Ministry of Digital Transformation, but we have a network of digital deputy as me, chief digital transformation officer of any ministries. I have digital partner in any ministry to connect and make something together. And when we talk about partners, I say thanks to World Food Program, World Bank, and UNICEF, who support us in different projects, because we talk not only digitalization, not about digitalization for digitalization. We talk about purpose. We talk about additional result for people-oriented result. And we talk about not only about digital solution, we talk about transformation for people categories and in difficult circumstances from hard situation to normal economical life. And our digital solution and our digital solutions, our social benefits, our social services, it's all about this purpose. And I think that it's a main idea for our partners to support our different projects from their mandates they have.
Fantastic. Thank you so much. So I think that all that's left for me to do is to say an enormous thank you to all our speakers and panelists. So first, thank you to Christy and Jamele for presenting some of your research. We should expect that forthcoming.
Yeah, I don't know, Jamila, what do you like in the next few months?
The next few months,
Yeah.
fantastic. We're going to keep an eye out for that. Costa, Veronica, thank you so much for taking the time out of your busy schedules to share with us some of the fantastic work that you've been doing and some of your lessons learned. Really appreciate it. And finally, Richard, thank you so much too for sharing some of your reflections. I think that's been really, really helpful for all of us, both online and in the room. So thanks very much to everyone, and for those of us joining for the next session, I think that's starting in 15 minutes.
Thank you very much, everyone.
Thanks
Keep in
all.
touch, colleagues.
Thank you. Bye.